Hello everyone, my name is Taylor Watterson and I'm excited to share findings from our project regarding health IT to support medication adherence, usability of RxFill. I want you to imagine Mrs. Jones. 6 months ago, she was diagnosed with high blood pressure and prescribed a new medication. She took it for a few weeks, but started developing a bothersome, dry, hacking cough, which she attributed to the medication and stopped taking. At her follow-up appointment, her blood pressure was still high because she wasn't taking her medication, but her doctor didn't know that. She only said, "You're taking your blood pressure medicine, right? We'll just have to increase the dose." Mrs. Jones was embarrassed. She didn't want to admit she wasn't taking her medication, but now her blood pressure is still high and she's on too high of a dose. Mrs. Jones's problem isn't unique. In the United States, upwards of 50% of patients do not take their medications as prescribed or are non-adherent. Medication non-adherence and its associated negative health outcomes result in over $100 billion of avoidable healthcare costs annually. Prescribers, including primary care prescribers, are great resources to address non-adherence, but they have to know whether non-adherence exists. The obvious answer is to ask the patients, but they aren't always the most reliable for a number of unintentional or intentional reasons. Another solution might be the patient's pharmacy or the patient's pharmacy insurance. They have the dispensing and claims information for when the patient received the medication, but this can often result in long wait times, complicated faxes, or receiving the information at the wrong time. So a solution is to look to health information technology, or health IT, to help prescribers make informed clinical decisions. RxFill is a health IT that integrates dispense dates from pharmacies into the clinic EHR. Our study took place at UW Health, an academic health system that implemented RxFill in June 2022. UW Health uses Epic as their EHR vendor. 8 UW Health primary care prescribers were invited to participate and asked to review a simulated patient chart like they normally would. They were instructed to view RxFill and prompted to think aloud and share their thoughts on RxFill usability and ease of use. To locate RxFill data, prescribers were required to run a report for each medication. To do this, first, prescribers have to click on the medication. Then, they have to generate a report using a hyperlink. Then, and only then, are we able to receive the dispense dates. Participants reported RxFill data was useful to estimate patient adherence by comparing the dispense dates to the quantity, directions, and day supply of the prescription. Participants also mentioned the RxFill dispense dates were useful to compare to other indicators, such as vitals, labs, therapy outcomes, patient reports, or prescription refill requests. When RxFill dispense dates suggested non-adherence, participants discussed opportunities to integrate medication conversations into the patient encounter. However, participants reported that the process of running reports for each medication was time-intensive. Participants stated they had minimal time to review patient charts prior to appointments, which would limit their ability to use RxFill in practice. So when we think about RxFill and its usability, we might consider instances where the dispense dates might be the most useful. Now, granted, they're still much faster than calling the pharmacy, but maybe we leverage RxFill for certain disease states, like diabetes, anticoagulants, or our patients who might be concerned about non-adherence. Maybe RxFill is most useful for our other team members, our nursing colleagues when seeing patients, or even our medical students, and medical assistants may be able to triage this information and identify patients requiring clinician attention. Or maybe we can redesign the system. Human factors engineering tells us it's not just about health IT's usefulness, but it also has to be easy to use. Health IT has now integrated electronic pharmacy benefit manager claims into the EHR using a design strategy that we commonly see in traffic lights. Now, right on the main screen, we see colored discs color-coded to indicate adherence, and a hover to discover functionality that integrates the claim dates to calculate patient adherence as a proportion of the days they have the medication at home. It brings the information right to where folks need it. No more digging for information. But that's just the first step. Prescribers still have to use and act on this information. How do they bring it up in conversations of adherence with patients? Do they say, "Hey, you're not adherent because my computer says so"? Likely not. Ultimately, it comes back to our patients. This health IT isn't meant to overshadow or eliminate good communication practices between prescribers and their patients. That's critical. But we're hoping to arm prescribers with information, but not overwhelm them, that helps them to give their patients the best prescription for safety. And with that, I want to say thank you and quick acknowledge our grant funder, NCPDP Foundation, and HRSA, who supports me through a T32 postdoctoral fellowship. Thanks!